The South African Medical Association Trade Union, SAMATU, has raised concerns about the rising number of unemployed doctors in the country. The union says it has extensively engaged with the relevant authorities, including the National Department of Health, where a list of unemployed doctors was submitted but has not received a positive response from the authorities. SAMATU believes that the state should utilize the scarcity of doctors in the country and lack of resources in hospitals as motivation to employ more doctors. To speak more on this, we are joined by Sicina from the Young Nurses Indaba Trade Union. Thank you very much for joining us on the news.
Thank you very much for having us. Good evening to yourself and your team there and the viewers as well.
Okay, thanks for giving us your time. Trade unions, SAMATU, COSATU and yours are protesting today, calling for the absorption of unemployed community doctors. Could you give us a background as to what led to this protest?
In South Africa, we have a gross shortage of staff. It's even beyond being gross shortage of staff, of human resources. You name your professional nurses, your doctors as well. So today, because SAMATU, the union that is organizing doctors in particular, was actually staging a war against those in positions of authority. As health and allied workers in our trade union, we decided to say, let's be in solidarity with them. We are also organizing all healthcare workers. Let's be on the street as well, because we are myself, for example, I'm a professional nurse. I work in these facilities, and I will tell you that that the absence, the gross shortage of staff, of doctors in particular, is the reason why we always think that department or government is using healthcare workers as accomplices of murder. We were actually submitting a memorandum of demands today to say, don't release these doctors. When we are releasing them, you are actually saying you don't care about the community, you don't care about those who are doing the spade work, because it's absolutely wrong to say in South Africa one doctor can actually nurse provide medical assistance to almost more than 3,000 members of the community. That's really can't. We are tired of being used as accomplices of murder. All we are saying is, don't release these doctors. The system needs them. The community needs them.
During the protest today, the General Secretary of SAMATU said it was a tragedy that the country had over 1,000 doctors who were sitting at home while communities are struck with hospitals and clinics that have no doctor. Yet, we understand the Department of Health say they never made the commitment to the doctors to employ them. Are they still holding on to that position? If yes, what will the unions like yours do?
It's not even about them. They are just completely out of order. It's a disgrace as well for them in positions of authority when they know the country, the country in as far as statistics is concerned. We are saying in South Africa, even if you can employ all of them, even if you can employ all of them and distribute them to different sections of this country, rural areas and urban areas, we will still be having gross shortage of staff. For them to say we didn't make a promise, it's simple say they don't care what is actually happening in our public healthcare system in particular. So we were actually trying to send a very strong message out there to say it's not even about doctors only. It's that today the war was to outline or to highlight the plight of doctors in South Africa, but we are talking about professional nurses here. We are talking about allied workers that the system needs them. If then the Minister of Health, who actually came, Mr. Joe Pasha, and received the memorandum, if they actually don't ascend to our demands, we will intensify our struggle, and then we will then go to them saying, all we want now is for you to employ more nurses, employ more allied workers, employ more doctors, and they will be in big numbers. going forward. But then obviously when they receive these memorandums, even though they understand what is actually happening on the ground, they are promising to say we will come and we'll look into this and see how best we can do to try to solve the issue of gross shortage of doctors in the country. We have sent a strong message to say we are tired and we are going to revolt, and more organizations are going to join next time.
We hope that you find resolution to this situation. Thank you very much, Rich, for speaking with us.
Thank you very much for having us as well. Thank you.